This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Abhijit Lodeng. The headlines. Group of Ministers reviews current status and actions for management of COVID-19. More than 1 lakh PPEs and N95 masks being manufactured every day in the country. Interministerial central teams take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. NAFED to distribute about 6 lakh metric ton pulses to nearly 20 crore households for 3 months under Prime Minister Garib Kalyan Ann Yojana. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. The group of ministers, GOM, in its high-level meeting today, reviewed the current status and actions for management of COVID-19. It was the 13th meeting of GOM in New Delhi, in which a detailed presentation on the status of COVID-19 in the country, along with the response and its management, were made. The GOM had a detailed deliberation on the measures taken as on date by the centre and various states and union territories for prevention, containment and management of COVID-19. The GOM was informed that all districts have been asked to follow and further strengthen their contingency plans to combat COVID-19. It was briefed on the state-wise details of dedicated COVID-19 hospitals along with the adequacy of isolation beds, PPEs, N95 masks, drugs, ventilators and oxygen cylinders. The GOM was informed that domestic manufacturers, which have been identified earlier, have already started the production of PPEs and masks, and at present the stock is available. It was informed that more than 1 lakh PPEs and N95 masks are being manufactured every day in the country. There are at present 104 domestic manufacturers of PPEs and 3 making N95 masks in the country. In addition, production of ventilators is also started and orders have been placed for more than 59,000 units through 9 manufacturers. The GOM also reviewed the testing strategy and availability of testing kits across the country, along with the strategy for hotspots and cluster management. The GOM also deliberated on various tasks assigned to various empowered committees and presentations were made. It was apprised that around 92,000 NGOs, self-help groups and civil society organizations are working and contributing by providing food to the migrant workers across various states. These NGOs are supported by the states by allotting funds from State Disaster Response Force (SDRF) and by Food Corporation of India, which is providing the food grains at subsidized cost. The GOM was also informed that a national level metadata of health workers, doctors, NCC and others has been prepared and shared to all the states, districts and other officials to mobilize the resources and COVID warriors to much needed locations. There is presently data of more than 1.24 crore human resources on the dashboard. These COVID warriors are being trained through online platforms and so far more than 10 lakh personnel have been trained. The GOM was also apprised that as of now, the death rate is around 3.1%, while recovery rate is more than 20%, which is comparatively better than most of the countries and may be taken as a positive effect of the lockdown in the country, along with cluster management and containment strategy. It was said that the average doubling rate of the country is 9.1 days as of now. During the meeting, the chairman of the GOM and Union Health Minister Dr. Harshvardhan commended the dedication and hard work of all the stakeholders at all levels. He informed that in view of the urgent need for addressing the issues of stigma and discrimination of patients and also the healthcare workers combating with COVID-19, the Ordinance for Amendment of Epidemic Diseases Act 1897 has been recently promulgated with very stringent provisions. Civil Aviation Minister Hardeep Singh Puri, External Affairs Minister Dr. S. Jaishankar, Minister of State for Home Nityanand Rai also attended the meeting.
New interministerial central teams constituted by the Ministry of Home Affairs today took stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. In Telangana, the interministerial central team, which reached Hyderabad earlier in the day today, took stock of COVID-19 pandemic situation in the capital city. The central team, led by Additional Secretary in Jal Shakti Ministry Arun Baroka, called on the State Chief Secretary Somesh Kumar and visited the Telangana Institute of Medical Sciences and Research at Gachibowli. Our correspondent says the team inquired about various aspects like observing of the lockdown, following pandemic protocol, treatment of COVID-19 patients, among others.
A day after its constitution, the 5-member central team has begun its assessment about the preparedness of health sector in combating COVID-19 in Hyderabad, where high number of corona positive cases are being reported. The team called on State Chief Secretary Somesh Kumar to know various initiatives that the state authorities are implementing to contain spread of coronavirus. The central team went round the newly set up 1500-bedded COVID treatment facility at Gachibowli and inquired all the details from the health staff and gathered information from the medical officials about medical care being taken in the hospital. The team will also share its expertise with the state officials for effectively tackling the pandemic, besides meeting the DGP and visiting GHMC control room tomorrow. Lakshmi, AR News, Hyderabad.
The Inter-Ministerial Central Team, led by Additional Secretary in the National Disaster Management Authority, Dr. V. Tirupazag, reviewed the arrangements today in Chennai to contain the disease spread. Meanwhile, in Tamil Nadu, 94 patients were discharged today from hospitals, while 66 new cases have been confirmed. One person died of the disease, taking the toll to 23. More from our correspondent.
The Inter-Ministerial Central Team began their assessment of the ground situation by reviewing the overall measures to contain the spread with the State Chief Secretary and other senior officials. Later, they met the Chennai Corporation officials and took note of all the containment activities, testing and treatment facilities, and the relief measures, besides the actions being taken to ensure the lockdown conditions. They also visited a quarantine facility at Tondayarpet in the city. Tomorrow, they are planning to see for themselves the sanitary and social distancing measures being followed in Coimbatore market in the city, which is touted as one of Asia's biggest wholesale markets, dealing with food grains, vegetables, fruits and flowers. Meanwhile, the state has improved its COVID-19 patients' discharge ratio to 52.7%. Jai Singh, AR News, Chennai.
In Gujarat, 2 inter-ministerial central teams reviewed the COVID-19 situation in Ahmedabad and Surat today. Our correspondent reports that the teams held meetings with the district collectors and police officials in both the cities and took stock of the steps taken by the police and the administration in view of COVID-19.
The teams headed by Additional Secretary held round of meetings with senior officials including collectors, civic chiefs, police commissioners in Ahmedabad and Surat. District collectors and commissioners of police briefed the members on the steps taken by them to contain the spread of COVID-19. Ahmedabad team also visited Gandhinagar and held talks with Chief Secretary and other higher officials. Surat team also held talks with Chief Secretary Anil Mukim through video conferencing and discussed the issue of migrant workers stuck in Surat. According to sources, the teams are likely to visit the hotspot localities of both the cities tomorrow to take stock of ground situation. Aparna Khut, AR News, Ahmedabad.
A total of 24,942 confirmed cases of COVID-19 have been reported in the country so far. As per the Health Ministry data, out of the total cases, 5,209 patients have recovered and were discharged from the hospitals, while 779 patients have died. With this, now there are 18,953 active COVID-19 cases.
A massive operation for transport and milling of pulses is underway in the country to distribute 1 kilogram of pulses to about 20 crore households for 3 months under the Prime Minister Garib Kalyan Anna Yojana. This operation entails lifting of unmilled pulses from the godowns, getting the pulses cleaned and then reaching them to the states for distribution. Under the scheme, NAFED will distribute around 5.88 lakh metric ton pulses to about 20 crore National Food Security Act households through ration shops for 3 months. Most of the beneficiaries will receive the quota for the first month within April or latest by the first week of May. Department of Consumer Affairs has set up 5 groups of officers headed by joint secretaries to coordinate with states, NAFED, dal mills and warehousing corporations. The Cabinet Secretary is also personally monitoring the distribution on a day-to-day basis. More from our correspondent.
The distribution of pulses is intended to meet the protein needs of people during this hour of crisis due to COVID-19 lockdown. The central government has allowed use of its stock of pulses lying in about 165 Nefet godowns across the country for this scheme. Over 100 dal mills across the country have been pressed into service so far. The states and union territories have taken one-third of the monthly requirement of pulses to final destinations for distribution. 17 states and UTs including Andhra Pradesh, Assam, Chhattisgarh, Haryana, Maharashtra, Meghalaya, Arunachal Pradesh, Sikkim, Odisha, Rajasthan and Tamil Nadu have begun distribution of pulses. As on date, about 30,000 metric tons of pulses have been distributed, while several other states and UTs have decided to distribute pulses along with food grains distribution in the first week of May for reasons of social distancing and public safety. With Divakar Anand Kumar, AIR News, Delhi.
Now we bring you experiences of people who've been benefited from government efforts during COVID-19 lockdown. Vijender Singh, a farmer from Uttarakhand, expresses happiness over getting help under Kisan Samman Nidhi Yojana.
कृषि विभाग के सहयोग के कारण ही हमारे पास कृषि यंत्र हैं, कृषि फार्म मशीनरी बैंक कृषि विभाग ने जो हमें दिया है उससे हमें खेती करने में बहुत सहायता मिली है और इसके साथ साथ हम ये चाहते हैं कि सरकार ने जो ये खाद और बीज पर हमको सब्सिडी प्रदान करती है वो भी एक प्रशंसनीय कार्य है.
Soni from Goriaband of Chhattisgarh thanks Prime Minister Modi for help under Pradhan Mantri Ujjwala Yojana.
अभी तो 3 महीना तक कभी हमारा सिलेंडर उज्जवल वाला सिलेंडर मोदी सरकार भरवाही, कभी 1 महीना के तो खाता में पैसा आ चुके हैं, अभी 2 महीना तक कभी हमारा हल करी मोदी सरकार तो इसे हम की चिंता में लगे थे.
In a reprieve to public at large, government has permitted registered neighborhood and standalone shops to open from today onwards amid the coronavirus lockdown. However, market complexes within the limits of municipal corporations and municipalities will not open. The exemption has also not been given to shops and marketplaces, multi-brand and single-brand malls located in municipality areas, coronavirus hotspots and containment areas. Home Ministry today clarified that all shops in rural areas except those in shopping malls are allowed to open. In urban areas, all standalone and neighborhood shops and shops in residential complexes are allowed to open. More in this report.
Shops in market complexes and shopping malls are not allowed to open. Home Ministry in its clarification further said, sale by e-commerce companies will continue to be permitted for essential goods only. Sale of liquor and other items continues to be prohibited as specified in the National Directives for COVID-19 Management. No shops will be permitted to open in hotspots and containment zones. Amending its April 15 order, the Home Ministry said the shops will mandatorily have 50% strength of workers wearing masks and following social distancing. The opening of neighborhood shops is being seen as a relief to people who have been under lockdown since 24th of March to contain the spread of novel coronavirus. The Home Ministry order came on the eve of Muslim holy month Ramzan. With Suparna Saikia, Anupam Mishra, AIR News, Delhi.
Government has clarified that all restaurants, salons and barber shops will remain closed. It said the render services and the relaxations given under lockdown restrictions yesterday pertain only to shops selling items. The clarification was given by the Home Ministry spokesperson today.
A control room has been set up in the Lok Sabha Secretariat with immediate effect to facilitate a quick interface between MPs, MLAs and the public for emergency assistance in the fight against COVID-19. On a call by Lok Sabha Speaker Om Birla during a video conference with presiding officers of state legislatures last Tuesday, several state legislatures have established control rooms for immediate assistance. Rajasthan, Haryana, Odisha, Delhi, Uttarakhand and Madhya Pradesh are the first states wherein control rooms have been set up in their respective legislature secretariats. The control rooms have already started functioning to help real-time exchange of information between state legislatures and the Parliament. This will allow MPs, MLAs and MLCs to discharge their duties in a more effective manner in the fight against the challenge posed by COVID-19. Congress President Sonia Gandhi today demanded a financial package for the revival of the micro, small and medium enterprises sector in the country. In a letter to Prime Minister Narendra Modi, she urged him to announce a 1 lakh crore rupees MSME wage protection package and also a credit guarantee fund of an equivalent amount for the sector. She also demanded a 24/7 helpline for helping them out of this crisis due to COVID-19 pandemic. Before we move on, a reminder of the headlines. Group of ministers review current status and actions for management of COVID-19. More than 1 lakh PPEs and N95 masks being manufactured every day in the country. Interministerial central teams take stock of the COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. NAFED to distribute about 6 lakh metric tons of pulses to nearly 20 crore households for 3 months under Prime Minister Garib Kalyan Anna Yojana. And Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. For quick news updates round the clock, follow us on Twitter handle @AIR News Alert.
All the popular programs of Doordarshan now on DD Retro. Mahabharat, Shaktiman, Sankat Mochan Hanuman, Bunyad, Dekh Bhai Dekh, Chanakya, Upanishad Ganga. To watch all the popular programs of Doordarshan now on DD Retro, contact your local cable operator.
लोकप्रिय धारावाहिक महाभारत प्रतिदिन दोपहर 12 बजे और शाम 7 बजे डीडी भारती, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। DD 60, टाटा स्काई 1194, एयरटेल 151, सन डायरेक्ट 326, वीडियोकॉन DTH 480, डिश टीवी 197 और डेन 522। समय याद रखें, दोपहर 12 बजे और शाम 7 बजे। प्रतिदिन देखें लोकप्रिय धारावाहिक महाभारत।
श्री महाभारत कथा।
Prime Minister Narendra Modi will share his thoughts with the people in the country and abroad in his Mann Ki Baat program on All India Radio tomorrow at 11 a.m. It will be the 64th episode of the monthly radio program. It will be broadcast on the entire network of AIR and Doordarshan and also on AIR News website www.newsonair.com and News on AIR mobile app. It will also be streamed live on the YouTube channels of AIR, DD News, PMO and Information Broadcasting Ministry. AIR will broadcast the program in regional languages immediately after the Hindi broadcast. The regional language versions will also be repeated at 8 in the evening. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Purva Mathur, Professor of Laboratory Medicine, AIIMS, has said that social distancing is very important to check the spread of the virus.
The coronavirus spreads by droplets when a person coughs or sneezes. These droplets do not travel beyond 1 meter, and that is why it's important to maintain social distancing.
Dr. Nandakumar, Professor of Psychiatry, AIIMS, suggested to the people to stay at homes, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. In the coming few weeks, stay at home, spend time with the family, do household work, exercise, listen to music, sing with the family, do yoga, meditation, and take care of emotional needs of the family and yourself.
Responding to the call of Prime Minister Narendra Modi to help the countrymen by way of relief material during the present COVID crisis, Rotary Club of Delhi Heritage is supplying close to 50,000 reusable face masks for wide distribution in coordination with the Press Information Bureau. The face masks have been made by women tailors while working from their homes during lockdown period. The distribution was done today by Principal Director General PIB Kuldeep Singh Tatwalia and others on behalf of Rotary Club of Delhi Heritage. The masks were handed over to Deputy Commissioner of Delhi Police Ish Singhal and Chairman and MD Kendriya Bhandar Mukesh Kumar at the National Media Centre in New Delhi. The masks were also distributed to press persons earlier. Delhi government has extended its list of cluster containment zones to 95 from earlier 92 zones to contain the spread of COVID-19. Entire street number 9 and gully number 3 of Shalimar village as well as some parts of gully number 3 of Yadav Villa are the new hotspot zones. Orders have been given to seal the demarcated zones under the Operation Shield of the Delhi government. In an effort to guard against fake news being circulated on various platforms, we bring you a segment on fact-checking and mythbusters. Union government today dismissed reports doing rounds on social media that it is giving 1,000 rupees to all under Corona Support Scheme. In a tweet, Press Information Bureau clarified that no such scheme is being run by the central government and the claim is false. It said the link given in the message on social media is fake and urged the people to beware of fraudsters.
In Karnataka, Uyamballi Gram Panchayat in Kanakapura Taluka has adopted best practices in the fight against COVID-19 pandemic. It is one of those Gram Panchayats which has implemented the containment guidelines in both letter and spirit. More from a correspondent.
Uyambali Gram Panchayat has taken people into confidence and successfully gained their commitment to combat the pandemic. According to the Gram Panchayat Development Officer, Munimare Gowda, the Panchayat has initiated medical checkup of 10,500 people living in 43 villages within the Panchayat limits. The ASHA workers, equipped with digital thermometer, mask and sanitizer, go door to door to check the body temperature of residents. There are 886 persons under home quarantine awaiting results. The District Health Officer, Dr. Niranjan, has said that Corona test results have confirmed 417 negative cases and rest of the test results are awaited. Sudhindra, AIR News, Bengaluru.
As Kerala continues to effectively contain COVID-19 infection in the state, the role of local self-government bodies, especially panchayats in the process, is making the world look back at the Kerala model of containment. A report.
The local self-government bodies are the pillars of Kerala's multi-pronged strategy in the battle against COVID-19. The panchayats, municipalities, corporations, etc. are entrusted with the task of collecting information, spreading awareness, identifying the vulnerable sections, ensuring quarantine and lockdown measures being followed, cleaning and disinfecting the public places, ensuring the availability of masks, sanitizers, essential commodities, etc. They are the pillar of community kitchen in the state, ensuring no one remains hungry. Local bodies play a major role in ensuring that destitutes, migrant laborers and other vulnerable sections are not being left out. When some panchayats like Vadakekera encouraged vegetable farming at home, promoting good food, the Tannirmukam Grama Panchayat in Alappuzha came up with the novel idea of using umbrellas to ensure social distancing. Mayush Shah for AR News from Thiruvananthapuram.
In Assam, state government undertaking Assam State Transport Corporation ASTC buses have started journey this afternoon carrying thousands of stranded people. Assam government took the decision to allow inter-district movement over the next 3 days from today to help stranded people to return home or visit hospitals while strictly adhering to lockdown norms. More from our correspondent.
Official sources in Guwahati said that over 50,000 people have applied for travel passes within the state. However, no passengers from COVID-19 hotspot areas have been allowed to avail journey. Transport Department has made 4 boarding points in Guwahati, while in other districts, AFC stations have been designated as boarding points. Manaspatim Sharma, AR News, Guwahati.
In Himachal Pradesh, where people from all sections of the society are trying to contribute at their own level to deal with COVID-19 pandemic, at the same time, religious and social institutions are also performing their duties well in this crisis. A report.
A shelter home set up for migrants at Radha Swami Ashram in Solan district is exemplary in its own. Each day program organized in ashram in an orderly manner for people living here, self-discipline with knowledge, meditation, yoga, health, sport, entertainment and catering besides residential arrangement in itself is commendable. The Satsang Bhavan has a capacity to hold more than 2,000 people. Regional Secretary of Radha Swami Satsang Bhavan Paramjit Singh says that doing human service is his religion and to serve humanity in times of crisis is the best opportunity for him. People and institutions with the feeling of service towards society are rarely seen, but this institution has proved that human service is their ultimate religion. With Lakshmi Dutt Sharma report from Solan, this is Sanjeev Sundaryal, AIR News, Shimla.
Prime Minister Narendra Modi has lauded India Post Office Network and hard-working postmen for their stupendous efforts in assisting people during this time. Mr. Modi lauded their efforts through tweet while referring to Communications and IT Minister Ravi Shankar's comments. Earlier in a tweet, Mr. Prasad had said, from doorstep delivery of essentials, financial transactions and medical equipments to ensuring food and ration for the needy, India Post Office is delivering hope, assurance and happiness to citizens through its services during lockdown.
The Nepal government has extended the suspension of domestic and international flights till the 15th of May as a precautionary measure to contain COVID-19. The decision was taken at a meeting of the High-Level Coordination Committee for the Prevention and Control of COVID-19 held in Kathmandu today. Earlier, the flights had been halted until 30th of April. A total of 49 cases of COVID-19 have been reported in the Himalayan nation so far. According to the Ministry of Health and Population, 12 people have recovered while the remaining 37 are undergoing treatment and their condition is normal. In Sri Lanka, the ongoing curfew in 4 high-risk districts, including Colombo, has been further extended till the 4th of May in a bid to tackle COVID-19 crisis. Earlier, the curfew in these districts was to end on Monday. President's office said the curfew in Colombo, Kampaha, Kalusara and Puttalam districts will be eased from the 4th of May in order to facilitate the functioning of public and private sector institutions. It said the curfew in the rest of the 21 districts will see relaxation from 5 a.m. to 8 p.m. and will be lifted from the 1st of May. Curfew in these low-risk districts was relaxed on weekdays this week but was reimposed at the weekend.
Muslims are observing the first day of the holy month of Ramzan across the country today. In Uttar Pradesh, people today followed COVID-19 lockdown guidelines of the Health Department during Iftar and the special prayer Taraweeh. With the lockdown in place till 3rd of May, this is a Ramzan without the usual gatherings at prayer time and during meals. A report.
People of minority community greeted each other on phone yesterday after sighting of moon and beginning of Ramzan from today and made preparations at home for Sahari, a meal before beginning of fasting. There was no rush to mosque or on a street and Muslims quietly welcomed the holy month with a prayer for the safety of their loved ones in the wake of the pandemic. All imams, ulema and Muslim organizations in the state have unanimously decided that during Ramzan, Muslims will not congregate in mosques, religious places and perform all rituals like Iftar and Taraweeh at home, keeping in mind social distancing norms. Talking to AIR News, famous Sunni cleric and Imam of historic Ashbagh Eidgah of Lucknow, Khalid Rashid Firangimeli said that humankind get rid of this deadly virus as early as possible. Darul Uloom Deoband, in its 16-point guideline as a fatwa, has also advised people against holding Roza Iftar, offering namaz and performing Taraweeh in mosque. Sushil Chandra Tiwari, AIR News, Lucknow.
In Jammu and Kashmir, proper social distancing is also being strictly maintained by the people of Kashmir in an effort to prevent the spread of COVID-19. More from our Srinagar correspondent.
Srinagar District Administration in Jammu and Kashmir has prepared 50,000 food kits for distribution amongst impoverished families in Srinagar during the month of Ramzan. The idea behind the initiative is to offer support to those in need during the lockdown in place to prevent the spread of coronavirus pandemic. Each of these food kits will include 5 kilograms of rice, 2 kilograms of wheat and a packet each of cooking oil, tea and spices. The administration has identified needy families across Srinagar and distribution of these kits has started today. Most of the Muslim religious leaders and organizations have thrown their weight behind the administration's effort to curb the spread of the virus, urging followers to pray at home and follow the government's instructions of maintaining social distancing. This is Sunil Kohl for AIR News from Srinagar.
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Avdesh Sharma, an eminent psychiatrist and consultant, will participate in the discussion. Listeners can ask questions related to stress, anxiety and depression during the COVID-19 pandemic on the toll-free number 1800-115767. You can also ask questions on the telephone number 011-2331-4444 and post queries on our Twitter handle @AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates.
Union Minister for Chemicals and Fertilizers, Dr. D.V. Sadananda Gowda, has congratulated the chemicals and petrochemicals industry on becoming the top exporting sector of the country for the first time. He informed that during April 2019 to Jan 2020, the export of chemicals grew by 7.43% over previous corresponding period. And now, before we end, the headlines once again. Group of Ministers reviews current status and actions for management of COVID-19. More than 1 lakh PPEs and N95 masks being manufactured every day in the country. Interministerial central teams take stock of COVID-19 situation in Hyderabad, Chennai, Ahmedabad and Surat. NAFED to distribute about 6 lakh metric ton pulses to nearly 20 crore households for 3 months under Prime Minister Garib Kalyan Anna Yojana. Prime Minister Narendra Modi to share his thoughts in Mann Ki Baat program tomorrow. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.